Okay, here we are again. Another Monday night with Mondays with Maishi here out of Lakewood, New Jersey. I'm your host, Maishi Norman. It is February 26th, 2024, 9 p.m. here on the East Coast in New Jersey. And it's nice to have everybody back. For those of you who could turn on your videos, thank you, Cecil. For those of you who can turn on your videos, we always love that. And if you can't, we also understand it's late at night and not everybody's looking their greatest. But if you can, of course, please do. And if you can, at some point during the show, if something changes and you can turn it on, then turn it on then. And let's take a look
Do I
at,
have the option to turn it off?
to turn off your video. Well, if you blush, you can turn it off.
Okay.
Okay. So welcome everybody and thank you for joining. Tonight we have the honor of the presence of Yisroel Isaacs, who's an LCSW in upstate, well, not upstate New York, but almost upstate New York. I don't know if that's called upstate New York. But
I'm in
from
Brooklyn, it's kind of upstate.
you're in Brooklyn.
No, if you're
If
in
you're in
Brooklyn, Rockland is
Rockland
upstate.
County. Okay.
Yeah.
So tonight's discussion is actually a very, very important and interesting discussion. I was learning before the show that it's more important than I actually thought, because apparently because of some of the legalities and complexities and complications that come up in divorce situations, there is some challenge and hesitation. I was thinking more about the process of divorce and therapy and the process between the therapist and the client. But Yisrael was talking to me about the working with divorce itself in therapy and how complicated that could be. So hopefully we're going to learn a little bit about that tonight, about what some of the complexities are and how to work around some of those things. But before, Yisrael, why don't you just tell us a little bit about who you are, how you got into this, and what your role is, what some of your roles and hats are that you wear, because I know they're numerous. So, and thanks for joining tonight.
Right, thank you for having me. It's really an honor to be here. I've heard about this this podcast for quite some time, and it's kind of something that I've always felt that maybe one day I'll be here, and here I am. So thank you for having me. I'm, as you mentioned, an LCSW. I've been practicing social work since 2013, so about 11 years. In that time, I've had my foot in both the clinical side of social work and therapy, as well as the administrative side, whether it be in my first job, as a case manager and entitlement specialist at OHEL, to being a director of clinical director or administrative director in many clinics throughout the New York area. And all this time I've been accumulating knowledge in I guess the business side of therapy.
Mhm.
And my time feels very fulfilled because when I'm with a client, in those 45 minutes to an hour, like I really get to help one client. But like on the administrative side, in that 1 hour, my reach goes a lot further, I feel.
Good.
And it's it's something I enjoy, and so it's something that I've been doing. And while I've been doing that, I've been involved with different organizations, and one of them being the Derech Shalom Center, and some others that deal with divorce. And this is how I kind of got into it from the business side of it. But there's just that relationship with the clinical side as well, so I get to see that as well.
So I gather that that's where your interest in the divorced population started growing, when you started seeing some of the challenges that either the couples, the clients, or the clinicians were up against. Is that what happened?
Yeah,
Okay.
that's
Okay. So tell us a little bit about, some of the challenges that clinicians encounter, that clients encounter, and shed some light on how those could be circumvented or worked with.
So like I mentioned earlier to you and that you brought up, what I've been seeing is when people are getting divorced and they're looking for therapists. I've had therapists say like, oh no, thank you for the referral, but I don't take clients that are in the divorce process, or I don't take children from divorce, or if it's an act, meaning when it's active, not post-divorce, not when everything's settled, but really during the divorce process. And it made it very difficult for people that really needed help to get help when therapists weren't taking them. And I would ask like, why not? And then there would be many reasons, but mainly it was about not wanting to get involved in the legal side of things, getting subpoenaed or getting brought to court, or just being in the middle of um, fights and having to take sides. So it really was I saw a need for therapists to really know more about the process and be able to shed some light on what really goes into it, and how it's not as scary as they think.
Mm.
Maybe a little bit scary, a little
I mean,
scary, really
Yisroel, I'm
not.
thinking about, what you're saying. It would seem to be a somewhat of a legitimate concern. I mean, there is that risk of having to be called down to be subpoenaed for have your notes subpoenaed, have to testify and get a middle of the fights. And why is that not something that's legitimate, or what's the workaround?
Right. So we can discuss that at length later, but just to briefly answer it, let's pretend that we're a client and therapist right now. So let's explore this fear. Okay, so Moish, like, tell me what's the fear? So your notes are going to be subpoenaed, and
But I'm never comfortable having my notes subpoenaed. I don't know if they're written properly. I don't know if they may incriminate somebody unintentionally. I'd rather stay out of this whole process. And when there's so much of a higher likelihood that something like that will happen, I'd rather just stay away from it.
okay, and let's think for a moment. What's the worst thing that can happen if your notes are subpoenaed and they're not perfect, and they have something incriminating, or I don't know.
Well, I mean, it could potentially incriminate my client in something that was really unintentional. So it could be read and misinterpreted, in which there could either be legal repercussions, or some kind of repercussion where the ex, or whoever we call him or her, now get some upper hand, which in a way that was completely unintentional and completely perhaps even unreasonable.
Yes, and that's really tragic if that happens. But will you be okay?
I think that if something bad happens because of it, it'll be very difficult for me. I'll be very upset. If my client is very angry at me, in something that incriminated him or her, especially if it's not the truth, then I'll feel really badly. And if something bad happens, such as their spouse gets custody, and I believe that the spouse is really not uh, capable of having custody, and it's bad for the children or whatever, then I'll feel doubly bad.
Right. And yeah, and that's terrible. But let's shift over to your work with another client, where we do our best with other clients, and sometimes it's never to me or you, obviously, but to other therapists, it can be not the best work for them, and their depression that they're trying to beat is not getting beat, or their anxiety, or any one of the issues that we as therapists are not necessarily being able to help them.
Mhm.
And so it's a little bit of a lesser uh consequence, but it's in your typical sessions with anybody, you always run the risk of not providing them with the thing that you want for them, the best for them. You try your best.
Mhm.
And how do we try our best? We we go to supervision and we get trained in the latest modalities, and we do everything we need to do to be the best that we can be. That same thing can also be done when we're working with a family that's in the divorce process, with the children as well. Just like we have to be at our best in any with any issue, we should be the best we can in these issues. Now, I mentioned that we're going to discuss it more later because it is something that I like talking about a lot, and we can talk an hour just about that. But the point I'm trying to say is it's the fear that I find people having is that like something's going to happen to them, like their license is on the line, or something, their yeah, pretty much their license. It comes down to like their license. Yes, we have to deal with the things that they're what if we're not good enough in being able to help them, but that's just another price and responsibility for ourselves to try and be better, right?
Yeah. So yeah, I mean, that's one concern would be the license. And then, as you're speaking, I'm jotting down a whole bunch of other concerns. Like I never thought of some of these concerns, and I would take somebody on in divorce situation, but now I'm rethinking that and actually thinking maybe I shouldn't. I mean, I don't know what to expect, I think is one thing. There's a lot of reputation stuff on the line because in these contentious situations, everybody creates a whole story. Everybody's story is the truth, and the story I'm watching couples that I'm working with who are getting closer to this process, and everybody's story seems so true, and the other therapist is a bastard and is terrible, and these are things that make the process, sort of take the therapist out of the ability to be present in the process with the client and have them start to have to be concerned and anxious about their own reputation and saving their own face.
Yes, the reputation is definitely another thing,
Mhm.
a consequence that you're bringing up. Now, again, I'm going to contrast it to a less intense case, where if, depending on who you're dealing with, you really run the chance of working with somebody who's just not happy with your service and can do the same thing. But it generally, the divorce brings, the worst in people, out of people. I'm thinking of a quote that I heard from a judge, where it was in dealing, when dealing with criminal, you see you know, the, the worst, you know, the worst the worst in people. And when dealing with divorce, you're seeing like the worst of good people. I have to remember the quote, but it was just really something like really divorce is can bring really,
Bringing out the worst in people.
yeah, and that's really unfortunate that it happens. But there's also the other side, with cases of divorce that are really not as intense, and we have the ability to help, the children or the individuals or the couples really work something out, and everyone, get the best help that they can. But to answer, so those are a lot of the cases we deal with. But when we're dealing with those difficult ones, maybe call me naive, but I like to have the benefit of the doubt. And when hearing, and I don't hear this often, but whenever I hear somebody complaining about a different therapist, especially as a therapist, I never take it as something that like was the truth. And that's because I'm a therapist and I'm giving them courtesy. But in my conversations with people that are not therapists, and they would ask me like for a referral, or they would ask me about like, oh, I heard something about so and so, I would turn it back to them like, what do you think? It's like, well, it sounds like because it was a divorce situation, maybe somebody went out of their way and was not happy. So they're saying these things. Like, I think deep down, people really do have this trait of Dal Chus and benefit of the doubt, where it's not necessarily what is being said. Now, if it's something that's, you're hearing the same thing over and over about a specific therapist, maybe there's smoke, there's fire. You really gotta do your due diligence and not go to that therapist. But I believe that a therapist who does the work properly and gets the proper training and works their transference and counter transference out, that they can really be there to help whoever it is in the chair that their client is, and if it's the child, that both the mom and dad in the worst of divorce come to understand that the child won't benefit from any of the nonsense that they try to pull, and it'll be a peaceful resolution.
Hmm. Okay. What about the concern that there are so many cooks that want to call up and intervene and get involved? And I as a therapist, I'm trying to stay razor focused on the process, on my client, and then everybody's calling up and adding their 2 cents and things like that. That makes, because there's another party here. So, and there's a lot of frantic and panicky family members and community members. It just calls for a very messy, noisy circumstance versus when you're
Right.
working with an individual one-on-one. It's you and the client. There's a trance, there's a focus. The peripheral stuff doesn't confuse and shake everything up. What about that
Yeah,
aspect?
so great question. So I'm going to divide it in two. So first, just to remember confidentiality, consent, really before having any conversation with anybody, even, getting familiar with the laws of custody. If one parent has custody and the other doesn't, like, even though it's the parent, you may not be able to talk to that parent, and you need two consent forms. And then there's the askanim and the uncles and the grandmothers and everyone else trying to get involved. So really making sure that you have proper consent to speak to everybody. And so that's one point. Another point that I guess is in the same conversation, the time, you didn't ask this, but the time spent not with not in session that you're getting paid for, all the collaterals that you're doing, if it's in a clinic, maybe you can bill it, maybe not, most likely not. But in private practice, all the work that you're doing, who's paying for all that?
Mhm.
So that the answer is kind of, it could be a benefit where you can make your your time and your rates very clear when dealing with a
Collateral.
family, with the collaterals of billing for those times. So if somebody's looking to for more time, if their caseload's not so full, maybe take a couple of divorce clients, because there's definitely a lot of those as you bring up. No, but the other thing to answer the question, the important thing really to remember is who the client is, right? So if it's the child, right, anything that's getting thrown at you, any person that's calling, really, yes, you may have more of that trance, that clarity with your client, that one client, because it's simpler. They're there, and that's the only one you're dealing with. But just remember, when you're dealing with everybody, who the client is, right? If it's one of the children, if it's a child, anything that's happening, if you're able to talk to them, how is this benefiting my client? There can be a lot, and you'll be surprised, be a lot of these calls that are coming to you where people are just getting involved and there's no reason for it. It's just, like you say, making things more complicated, and you can say, well, I'm really not at liberty to discuss this. This is not beneficial for the client, and you can speak to so-and-so to address these things. This has nothing to do with me or the client. There's going to be a lot of that, but just remembering, those three things, making a clear rate of all the time spent, not with the client, but all the collaterals, the confidentiality and consent, and just remember who the client is. Like, it's so many times just not for their benefit.
Okay. I just want to invite in, if anybody has any questions or comments, to click the reactions tab on the bottom right of the screen and raise your hand, and we'll call on you. Want to also remind everybody that we're currently sponsored by okclarity.com. OKClarity is a website that will promote mental health professionals, coaches, psychiatrists, and others. All you have to do is go onto their website and sign up with them, and you can have your own very own webpage where you can promote yourself. They can help promote you, and there's lots of good things that you can do now. You can actually give little mini classes for them once a month or something. You have these 15-minute classes where you're able to promote yourself or promote some of your content. You can put videos of yourself on your website. So take a look at okclarity.com if you would like to have yourself promoted. Yisroel, I want to ask you something.
Yes.
I work with an individual. He's my client. We're doing individual work. We're doing very clinical, psychodynamic, whatever, very clinical work. And then he begins the divorce process. Okay. I'm struggling with the idea of clinical versus practical advocacy. What's my role as a clinician or as the clinician of somebody beginning this process? How much do I need, how knowledgeable do I need to be about this process? Is it appropriate to stay in the role of very clinical and exploring what he wants and exploring what's better, just like you kind of did with me when I was playing therapist before, right? You were asking me what's getting in the way and why wouldn't I want to? What are my fears and anxieties? Is that an option in a clinical role, or must I now suddenly know about the court systems, be able to give information, advocate, and all of that? And then we sort of lose sight of the clinical work, and I'm becoming more of a social worker than a therapist. Can you help me put this all together? Because I'm trying to
Yes.
navigate this process of divorce.
Great question. So the simple answer is the former. It's really staying in the role of therapist. Now, what is therapy? What are some common issues in therapy? And then what are some common issues that somebody who's going through divorce is dealing with? And they're really, match up, so there can be grief and loss. And I actually have a list that I'm going to read. Adjusting to change, parenting concerns, self-identity and self-esteem, financial stress, loneliness and isolation, coping, moving on, communication issues. It's really everything I'm reading is things that people that are going through a divorce have to deal with, but they're just things that
Standard
anybody can deal with, right? So the best thing that you as a therapist can really do is to stick to your lane and your expertise and help them during this process. Now, as this tends to happen in this role, there's like that attempt to shift as things can get more complicated, and so before we get there, the best thing that we can really do is also help for it to not be complicated. Now, I want to discuss what the things that are complicated, so to know what to avoid. So in your situation where your client is a middle-aged man or a child, I guess a middle-aged
Well,
man.
I'm
Yeah, I was
talking
gonna say
about
like,
hypothetically. So we're talking about a middle-aged man, let's say,
you're
who's
right. I was
working
meaning
towards
a child.
divorce.
Obviously, a child's not going through a divorce, but
Yeah,
meaning, what if parents are going through divorce?
right,
That's
right. No,
another
so
thing. Yeah.
I'm just talking about first, a
Right.
middle-aged uh, person
Yes.
who's entering the divorce phase, and now suddenly there's so much talk that comes up about resources and what do I do and who do I turn to and all that
Right.
kind of stuff, which I don't necessarily feel equipped to deal with. Another
Right.
reason I might want to stay away from taking on such a
Right. So referring to organizations that help is something that you can do. The reason why that's important is in divorce, I hear this so many times. It's like, oh, I spoke to my uncle who got divorced, or I spoke to my cousin who got divorced, or I spoke to my friend who got divorced, and they told me this, and they said I should do that, and to make sure this, and that's why they're taking that as their like word of God, and to make sure to follow that process, whatever that example may be. And it's not beneficial for them to do that, because every divorce is different. There's so many factors that go into it. So what may have worked for your aunt and uncle, may not be what's best for you. And that's why speaking to organizations that deal with this, or to therapists that are specializing in this, it's better for them to talk to them, because they can really evaluate the case and see what their needs are. But back to, our responsibility of making sure things don't get complicated, it's where we can talk about alienation and personality disorders, dealing with like somebody, a spouse with a personality disorder.
Right. So that was going to be a question I was going to ask you, which is, that the idea that you kind of made it sound very sweet that the happy ending, we're going to just be able to help the client, et cetera, et cetera. But in so many of these circumstances, there's a personality disorder or severe personality disorder, whether it's your client or the spouse. And that in and of itself complicates things, creates a lot of projective identification where the client is bringing in either their personality disorder or the spouse's, and causing the therapist to become so anxious, especially when there's all kinds of threats and threatening and risk and all that. So yeah, talk a little bit about to
All right.
that.
So actually about personality disorders, I like to tell people like to tell therapists to really make sure that what your client, like, if your client is describing their spouse or saying like, oh, they're borderline or they're narcissistic, just to remember the DSM criteria, and and also like the examples that they may be bringing, it may align with something somebody with a personality disorder may do, but it doesn't necessarily mean that they have it. To really rule out or or make sure that they have it, because we cannot base our whole treatment plan based on we know that they have it when they really don't.
The spouse's assertion that there's a personality disorder.
Right. And the same thing, also make sure that your client doesn't have a personality disorder. In a case that you described earlier, where you've been seeing that person for a while and now they're dealing with it, you would have picked up on the personality disorder early on. But if they're coming to you, while they're in the middle of the divorce process, they will do a very good show for the therapist and make themselves out to be not with the personality disorder, and the therapist really should be careful not to get sucked into that, and try to.
I actually have a few things to say about personality disorder.
Okay.
This situation. Number one is that very often what I've seen is that the spouse who is asserting that their spouse has a personality disorder is actually projecting their own personality disorder on the spouse. I've seen this on a number of occasions with clients. Maybe I should be saying this off the air because this is going to go public one day. But I've seen this on a number of occasions where a spouse. Actually, I have a fascinating story that happened many, many years ago, probably over 10 years ago, where somebody came in and said that his wife gets very angry and leaves the Shabbos table and storms away and doesn't talk for, gave a whole description of what his wife does. And then a number of sessions later, one of the kids came in, one of the teenage children came in, and the dad wasn't at that session. And he was saying, my dad's crazy, but and I said, what can you tell me about him? And he described his father with the exact same behaviors and characteristics that the father said about the mother. So here we have a sort of outside party saying, my dad storms away from the Shabbos table, and he won't talk, and he'll just leave whenever he's upset, and literally gave that same description. So it's like the person with the personality disorder who says my spouse has a personality disorder. If you don't know that situation well enough, you may actually just be experiencing a projection of the personality disorder person, him or herself. That's number one.
Yeah.
Number two is many people who have whatever anxieties or challenges may often experience things as much larger than life. So they'll tell you things that appeared in their perception of what's going on. My husband is so mean to me. He just dismisses me. He this, he that. But if you ask pointed questions and you pay close attention to the content, you'll actually realize that that's not necessarily the case. It's just an interpretation or perception of what's happening. So it's really important not to just accept at face value vague and open assertions like that. You want to get detailed. You want to ask them the details, and then you want to tune into yourself and say, does this feel as real or as vivid as the client is saying, or is it potentially perceptual? And the third thing is that you have sometimes clients who make general statements but don't back them up. So they'll say, my husband is always, he's so black and white and rigid. A client told me, my husband has borderline personality disorder. Sure has, what are some of the things that, I don't know, he's just so rigid. And what else can you tell me? Very not concrete information, but, sort of predetermined that, sort of as ammo that the spouse has a personality disorder or that the spouse is hurting them. When you really get to it and you ask them and get the details, you don't necessarily get that much content that's evident of that. So I agree with your point. It's really important to take into account and consider what your client is saying, but also to be suspicious, be open, and don't just accept it as fact. And again, it may be real, very, very real to the spouse that this is what's happening. But again, you sort of have to keep those clinical judgments and clinical hats on.
Yes, amazing clinical insight into that. I agree. Now, so back to some other complicated things that happen in session. It's co-parenting, especially if the other parent is difficult. There's religious differences in post-divorce, which is also something we would love to talk about soon. Now, the role of a therapist is just like any client. It's really to provide them the tools that they need to be able to deal with this. And sometimes it may be like grief, where it's having to accept something that they can't change. And it's hard to grasp sometimes because, when dealing with grief, at the end of the day, okay, this person passed away, right? So we cannot change that. Here we're in a divorce situation, or in a divorce situation, and we're dealing with outcomes that we don't necessarily like. We have a false sense. We're like, oh, there's something that we can do to change it. Again, I'm like really jumping ahead into it because I want to explain that also. But I'll get there in a moment. But we have to work with our clients sometimes that they cannot make those changes. And what I mean by that is that in another challenging situation is based on the agreements they may not like. And that's usually something that gets people down, because they want one thing and they were not able to. They want full custody, or they want more child support, or anything that they didn't get and they want, is having to deal with helping them accept that. Yeah.
Can you tell us about some of the challenges that come up in using the legal system? I mean, I've heard of situations where you have one parent who can represent themselves much better, but may actually be much less functional. And the courts or the Beis Din or whoever, buys into their story more. Although in all these cases, it's really hard to discern. Things get so convoluted and complex that it's hard to discern who, if one is sane and one is insane, and which one it is, because there's so many emotions running high. But I've heard so many allegations, at the very least, of the court really affording more custody or more credence to the more sane looking or functional looking spouse or parent. What are some of the challenges that we have to look for?
So before we get there, I like to work with the clients, or encourage the therapist to encourage the clients to avoid the whole legal route, and try to mediate, to go through mediation, helping your clients be healthy enough to be at the mediation table, painting a picture for our clients. Like, imagine, you have young children now, but imagine their wedding and what that wedding is going to be like. Will there be fights about who's paying for flowers and the hats and and the food and the catering and whatever it is, or will there be like a nice, peaceful, picture perfect, happy wedding day? And based on how you get divorced now, when your 2-year-old is 2, that is going to determine how that wedding is going to be. And the role of a therapist really is to work with their client to try and get there, and not let the anger take the wheel, because then some of the things that can happen can have drastic lifelong effects, and we want to avoid that. So that's, I always encourage, like, mediate when you can. Now the legal process, and even with Besdin and everything, really can be complicated, and how you represent yourself. So that's again another job for the therapist, is knowing what your clients' flaws are, and helping them when they're on the stand, or wherever they have to be, or when they're dealing with dealing with the courts, and knowing how to present themselves. So that can be a responsibility for the therapist. But as you say, there are horror stories in the good guy losing, based on who the lawyers were, and it's definitely sad, but it can be avoided by not going to court, or helping your clients with the resources that they need. Sometimes a case manager, or legal guidance, or any the organizations that have those supports early on in the divorce process can really help avoid these outcomes. Telling the clients, telling the man or woman what their rights are, and or asking if they have an expectation where they want A, and having them know that really B is maybe something better for them, and then, like I said earlier, the client then working with the therapist and accepting that B is what they're going to have. I do want to say something about lawyers. The lawyers can be very, very, if any lawyers are on, like, sorry, but lawyers can be very cunning, and they don't really care much about you. They just want to drag these things out. Not all lawyers, but a lot of lawyers, or some lawyers. So it's really best to make it clear to your lawyer exactly what you want, and the way for you to know what you want is to have the proper guidance.
Okay, so this is where it can be complicated to be a social worker, with your client, and that, do you yourself know what the proper guidance is? Is it your responsibility? But I think you made the point earlier that your job would be to refer to somebody who knows the system.
Right. Yes. And if anyone has interest in learning more, to get educated, so they could be there when first slowly, and then maybe eventually more. I did speak to a lawyer about this. Like, therapists are scared of subpoenas. Like, what do you have to say? I spoke to judges about this as well. The judge actually said that 90% of the subpoenas that are issued, they're not real. They're just like used as a scare tactic. They just want to intimidate. So it's really not to be worried about.
Meaning, aren't they usually coming from the lawyer, from the attorney, and not from the court?
Well, it's from the attorney, but the judge signs off on it.
So what does it mean it's not real? I mean,
it's not going to be used. Like, they're not gonna ask for it. Like, sorry, the subpoena as that we're seeing is usually like kind of like a warning that we're going to want to see it. It's not the actual one that it needs to be seen. It's like, get ready, not, okay, here, we need it.
So they don't really care for the most part about the therapist's notes.
Right. It's just it's like a tool in their arsenal to try and manipulate the other side and try to, scare tactic.
So
And
is that coming from the court or from the attorney? Who's looking to scare the other side?
that the lawyer, the other attorney. Yeah.
Mhm.
And any situation really can be twisted. So the lawyer I spoke to, he said that any situation can really be flipped. So for example, the case he used, and this is, uh a little graphic, right? So he said that, if the lawyer is representing the mom, right, and the kid said that they lay in bed with the father, in the morning, and the father is in his boxers. So the lawyer would be like, Your Honor, he's a pervert. He's not dressed. He's with, he's not appropriate. He shouldn't be with the child. Like, look at this, it's disgusting. But then if he was representing the father, he would say, like, it's very normal, this is the attachment, this is the time they spend together, like this is, a bonding moment, like it's the same situation, just kind of presented very differently. And the lawyer just said, like, depending on who he's representing, he would say he would say that, and just to get his way for his client, because they want to win. So it's unfortunate that where we have this situation, but sometimes this is what it comes down to.
Mm.
And that's why it's like even more important to support our clients when they're in this process, because it's not a picnic. It can be really difficult.
Wow.
Yeah.
You had mentioned earlier about confidentiality. Obviously we were talking about when, you have some clients who are just like, here, my life's in your hands. You can speak to anybody you want, right? Etc. But let's talk about children. And I'm sure that in different states there's different laws and all of that. But when it comes to children, what are some of the I guess questions, okay, legal questions that come up when you have two parents? One of them is dragging the child to therapy, usually just to prove that the other one's bad on some level, or that my kid needed therapy, right? There's so much of that mess. But then we have the issue with treating, can you treat with one parent's consent? Can you disclose to the other parent? Can you give us some idea, just again, without obviously giving legal advice, and I'm sure in every state it's different, but some idea of what some of the questions or complexity.
So the best thing really to do is to have both parents on the same page. In an ideal situation, this is what we want. But when we don't have that,
How often is the divorce is already not the ideal situation, right?
right. No, but like I don't know, I've been seeing a lot of cases, and this is not as common as, it happens, but not as common as you would think, right? Like, there may be early on, like, the lawyers fighting over who the therapist should be to see the client, and both parents have to agree situation. Like, sometimes it gets to there, but typically you have, some of the parents are seeing issues, or they're saying, oh, we're going through a divorce, we want our child to be in therapy, which is something else we can talk about, of what to look out for with working with children. But the parents recognize that therapy is needed, and they're generally both agreeing to send. But when you don't have that, which is the question, it's like, it's complicated, depending, uh what you're looking out for is really who has custody, right? So if it's split custody, I want to say most places, need both parents to, I may be wrong, but I think most of them need both parents to agree to it. So if you don't have the other, you may have an issue, or you can have an issue.
And
Agreeing.
then the same applies with pulling a child out of therapy. I had a very interesting situation once where I had started seeing a family, and then the parents got into a fight and into a quick divorce situation. Now, the father had begged me to see his daughter, who was a child, and I said that I wouldn't see his daughter. And then he, kind of begged me and this and that. I said, okay, I could do it under these circumstances. It's a parent in them or whatever it was. And then a week later, the mother said that she agrees to have me see the daughter. And I saw the daughter one time, and then I get, the father reaches out to me and says, "How dare you see my daughter without me consenting," or et cetera, et cetera. I'm like, what? You had been begging me to see your daughter. I don't understand. So he immediately pulled his daughter out and left me a whole voice note about what I did is unethical and I should be ashamed of myself or something like that. Who could pull out, and when, once this whole arrangement is in? And what about when it's not in the best interest of the child because he has an attachment figure or something, and now suddenly one parent is like, I want out.
Right. The example I like to say that may help you with some of the feelings that you're feeling is, pretend you're a mechanic, and somebody brings the car in for an oil change or for some service, and I don't know how many mechanics check the title or to see who is the owner of the car, and I don't know the laws of it, and I guess it is, as a therapist, we have a responsibility more than a mechanic to make sure everything's in place, but it's very normal to assume like, okay, this parent was saying, see my child, and we cannot blame a therapist for not necessarily doing so much homework and figuring out exactly, can this child actually be here? So I wouldn't be too hard, and not that you were, but if anybody has been feeling that way, it could be a normal situation to be in, and also part of the manipulation and complications that are in the divorce process. And don't take it too personally. It's not you, it's them, right? Now, when you're dealing with joint custody, that's the thing. Like, generally, everyone really has to be on the same page, and they have to figure it out before they get to you, whether they're keeping them there or taking them out, because otherwise, you end up being in the situation you were. Yeah, it's not easy, but again, it's things that they have to work out, and if the therapist that's working with him and her need to help them figure it out also.
Mhm. Okay, does anybody have any questions or comments that they'd like to share? Yisroel, what more can you tell us that's in this umbrella?
Okay, so children in, as clients, I had a woman recently ask me, she said she got divorced a few months ago, and she has 2 young children, and they seem to be doing fine. Does she need therapy for them? So, the answer, so I was kind of on the spot, and there were a bunch of people there, and I wasn't sure what she was looking for. So I gave the answer, the generic answer of like, well, if there are no issues, then then that's it should be fine, like, it's let's not look for problems. And then I was really thinking about it, like, was that the right answer or not? Because I guess I never really thought of it. Usually people come to me with the issues. And I was thinking that, that may be right. Like, if there are no issues, then why push for it?
Mhm.
But at the same time, not pushing for it, but like, let's not go looking for it. But at the same time, it really the responsibility for the parents to look out for things for a shift in behaviors, regression or how the role in the family system is changing and what depending on you know the question she asked me was also loaded because I didn't know what the father who if there's custody, if he has custody, or if he's seeing issues. So it's really there's a lot more that goes into it, but really everyone should be paying attention for some of the common things that could be coming up when after any change. So some of the signs, I also have a list here. Thought I had a list, but you can imagine, like, oh, here. So if they're regressing, they're acting like everything is perfect, which is, catch 22. Like if your child is too fine, like, are they really fine, right? Are they just pushing down all their feelings? Are they going towards unhealthy coping behaviors? Are they failing in school, or has their self-esteem, been affected? Are they being more aggressive? Are they anxious? Are they depressed? These are things to look out for in children, and that's where like any other therapist.
There's a point being made in the chat box by Nechama, which I'm not sure if that's what she means, but it's really important for therapists working with divorced families to look at the custody agreement and maintain a copy of that. Make a copy of the custody agreement, find out the law in your state as to who, and then keep a copy of that agreement, because in some cases, one parent will be sufficient, and then if the other parent comes screaming and swinging, in all likelihood, they'll probably sabotage the therapy anyway. So
Right.
whether or not they have a legal right to sabotage, to pull out, they might sabotage it. But you want to be able to cover yourself by having a copy of the agreement and knowing the law.
Yes, 100%. Thank you, Nechama. I think that was just to you, but I didn't see it. So maybe she didn't want to be called out.
Sorry.
So in that case, sorry, Nechama.
No, it's fine. What I was trying to say was that, like, we might get blinded as therapists by the practical. So you could have a case that, like, one party has most of the visitation, so you think you only have to ask that party, but the joint legal custody is usually a legal thing that I don't want to put a percentage because I don't know the statistics, but most cases, even where one party has minimal visitation, they still have joint legal custody. So I think just therapists might see the practical side of it without realizing that.
Right, correct.
Right.
Yes.
I was stretching what you said, right, to say that just make sure that you have a copy of that document. In any time that there is a divorce case that you're working with.
Yes. My screen is now.
Yisroel, one of the challenges that I see a lot is parents using the children as pawns, parents fabricating issues so that the children could be in therapy, which benefits them in so many different ways. I mean, sometimes they're just happy to spend the other parent's money. Sometimes they're excited to show that the other parent is causing distress to the child. I've seen all of these things. They're so brutal, in this process. I'm going to say something. Hold on. So
Yeah.
these situations can get really nasty and like as a therapist working with this kid, I don't necessarily see an issue. I don't see a problem. I see a parent who's freaking out. I see a parent who needs therapy. But the kids are getting stuck in between this, and it's just so ugly.
Right, and this is just to further my point of the importance of the work the therapists have for the clients that are children, because they need to get those tools and those skills and the strength to be able to deal with the dysfunction while it's happening until it settles. And I'm gonna also bring to the point of using the children as pawns or messengers, and that's something we can talk about also. But it's not always the case with malicious things, like sending simple messages You know, like, oh, like make sure Tati does this or make sure mommy does that. Or like make sure Tati doesn't forget to give you your antibiotics. Like a very innocent message. You know, the other the other spouse can really take offense to it and like, oh, she thinks I don't remember, she thinks I don't, that I'm not a good enough parent, that I need reminders, and then it just like adds fuel to to the fire where and that's like an innocent message. So much more to like other uses of pawns, using the children as pawns, and which is why it's really important to encourage your clients to have a system, set up and how they can communicate in a healthy way, and not to use the children, and then again to bring to the point to help the children um, with the resources they need to survive, and eventually live in a healthy way when this dysfunction is going on, because it's so unfortunate that it happens.
Hmm.
Yeah, it's what can we do? Be better therapists for the children and for our individual clients if they're in session, to help them not be this way,
Hmm.
and help them steer away from the anger that they have towards the other one, helping them process it. For this at the very least for the sake of the children, right? Their anger that they think that they're gonna have the last word, or they're gonna suck dry their money, and they're gonna they're letting their anger take the wheel, but at what expense,
Mhm.
right? And that's what the therapy is.
Hmm. Hey, any other questions or comments before we start closing down? Okay, Cheryl, is there anything else you wanted to share that you feel is important to this process?
I was going to talk a little bit about religious differences. It's also quite
Contentious, I'm sure.
yeah. So something that's been more common lately in the divorce process. But another thing interesting, the divorce rate in the US and the non-frum world is a little under 50%. Even in the more recent years through COVID, it increased like 3.6% or so, but it's still around 50%. And in the Jewish world, it's very hard to get the numbers. I saw numbers from 2017, which was 10%. And more recently, not actual numbers, they may exist, maybe caps, Dr. Schechter may have the numbers, but I was seeing 30% now in the Jewish and in the Orthodox Jewish world. So it's really been increasing over the last couple of years, and we could talk a lot about that as well, or it could be for a different time.
Sounds like a whole different
What's
discussion.
of what's happening in the marriages and in the relationships, and very I think it's a people are having just their lack of identity of who they are. People kind of can define themselves by what they do and their roles, but people don't really know who they are anymore. And that definitely can affect their relationships, especially when they're with somebody else who doesn't know who they are.
So talk a little bit to this point of religious differences in children.
Yeah, so now with religious differences, so I'm getting to that. So what's common in that is when a divorce happens, it's there's a lot of blame towards the system of one spouse may have, where that's why their relationship wasn't good and why they were being quote unquote abused, or if they were or if they weren't. We can talk about abuse as well, but it ends up with one spouse not being religious, and the other one still being religious, and that in itself opens up a whole other fight, which also is dealt with in court, like what the level
In the
of
child's best
hechsher,
interest.
what level of hechsher does, do the parents have to keep, and what, and chalamayid, and all these different terms that the court has to be familiar with, because these matter in custody. And Shushan Purim, somebody was just saying, where the lawyers have to know what Shushan Purim is, because usually the fathers don't want the kids Shushan Purim, because they're usually like coming out of a hangover. But back to religious differences. So one of the common things that I hear a lot is, I'm not going to say he or she in the situation where, like, so one parent would say, like, oh, when they're at the other parent, like, they're eating not kosher, or they're driving on Shabbos, or they're watching movies, or insert thing that goes against their values, and it's like it can be very frustrating and depressing and worrisome for them, and it also leads them to try and start fights as well for the sake of Yiddishkeit, for the sake of saving the neshama. So the answer that I give was based on this discussions that I've had with my rabbanim and rabbis and Orthodox rabbis that I've communicated with regarding this issue, and they all, not most, not some, but they all came back and said that it is better for the child to be in a car on Shabbos and not have their eating their cheeseburger while they're at the custody, while they're with the other parent, and rather than to start fights and make things even more complicated for the situation, and not be in a peaceful way. So so I encourage people to really speak to their rabbanim, and they may have different answers, and if that's the case, then you encourage your clients to follow their local Orthodox rabbi. But the ones that I've spoken to really are of the opinion, again, the situations are complex and really can depend, and like I said earlier, every situation is really different, but when I've brought these cases to these rabbanim, or have encouraged my clients or the clients of the therapists that have asked, and they came back saying to rather go in a peaceful way, and the children will eventually see and come to respect the parent if they are healthy and they are loving and doing their part. And when some of the parents, they overcompensate, like when they come to them for their custody, so they're gonna like really push and shove really intense forms of Yiddishkeit and practice in an unhealthy manner to try and balance it out, which is also not good. Like to strive for normal, healthy, the way things kind of were maybe before, or what your values are, and and if you don't know what your values are, to really explore what they are, and have a connection with a shir or a rabbi, just to get to, and even discuss it in therapy of what those are, to be able to give the children a healthy dose of Yiddishkeit, and they will learn to love that and recognize Yiddishkeit in its beauty more than when it's done in an unhealthy way.
Excellent, great point, and that's a great note to close on. And hopefully these things can be avoided and mitigated and worked out and worked through before. Let's take a question from Cecil. Go ahead.
Hi, I just like to thank Yisroel for, I work at the clinic where he works, and he's an amazing guy, therapist, supervisor. We learned a lot, and I was also subpoenaed once. I'd like to share it with everybody. It's not so scary. You just do have to be a bit tough. So to know that whatever you're doing is just perfect, even if the client may not be happy. When I was subpoenaed, I heard a lot of information the client did not want to share with me. And just me being there, standing tough kind of, and just showing that I'm here for you no matter what they say. I'm not changing my views about you. I'm not changing my thoughts of you. You're still the same important to me, and that mattered a lot to my clients. So, just be there for them.
Excellent.
Yes, thank you. Yes, good point.
Okay, well, Yisroel, thank you very much for agreeing to join us tonight and giving us, some of this information and your experience with the therapist's role in divorce in the therapeutic process. And thank you for sharing that with us.
Thank you. Thank you for having me. And if anyone has any questions, you can reach out to me.
Yes.
I don't know how to do that. Is there like an email I can put somewhere or?
Put the email in the chat, or I can put it in the chat. Yeah, go ahead.
Okay. All right, you're welcome, Shauna. I will put